Good afternoon. Just want to give it a couple minutes in case others want to pop in. We're right on the hour, so just a minute or two, and then we will get started. All right. Just wanted to see if everyone can hear me okay. Awesome. Thank you. Just give it another minute and we will jump in and get right started. All right. So while we are waiting, I can just do a quick introduction. My name is Brandy Salvatore. I'm an LCSW here at the Stephen A. Cohen Clinic in Alaska. For those of you that aren't familiar with our organization, we are a network that spans across the country. We offer outpatient mental health services to our military and veterans and their family members. We do, short term, it's evidence-based practices, and sorry. So we're in and out. We come in, we do the hard work, and then we send them out there with all of their new skills. And if they need us, they can always come back to us. Here, my role is a case manager. And as a case manager, I'm always looking for different kinds of needs that our clients may need, not just here, but all across the network. And one need that we identified was that our communities were, needing services when they were traveling during the winter and Christmas breaks, through that block leave. And so that is kind of how this was born. We did it last year. This year, we're really excited to bring lots of new topics, and some of the old ones we're bringing in and changing and updating a little bit as well. So really excited to bring those here to you today. We are doing it is a webinar version, so we don't have a lot of opportunity for chatting back and forth. But if you have questions, comments, anything of that sort, I did activate the chat box feature, so you're able to drop your questions into that chat, and I will make sure those get answered. In the meantime, while we're getting started, if you want to put in there, where are you watching from? Are you here in Alaska? Are you, in Texas? Are you somewhere else in the country, or out of the country even? Please share with us. Let us know where you're watching from. And then I will share my screen so you guys can see. It's a PowerPoint today. We're going through our winter blues or seasonal affective disorder. We get a lot of questions on what is the difference, or we hear a lot of times people will use them interchangeably. And while there is a lot of crossover, it's really important to understand what it actually is, how they're different, how they're alike, and what's the impacts of each one. So jump right in today, over this next hour, 50 minutes or so. some of the things that we want to do is make sure, what is seasonal affective disorder? How do we define that? We want to know what's the difference, what between the blues and seasonal affective disorder. And then also, what causes seasonal affective disorder? What are those kind of common symptoms? How is it diagnosed? How often? And what's the frequency of that? How does it impact our military? Because, that is our primary demographic. Though obviously they're not the only ones that struggle with that, with seasonal affective. And so, what are some treatment options, coping strategies? How do we prevent it? And just some local resources here in Alaska that could also be, probably similar in your own state. So, seasonal affective disorder. This is actually a type of depression. So, it's a major depressive disorder. And then it has kind of that little extra qualifier of seasonal patterns to it. It typically occurs within certain seasons, like fall, winter. That's when you hear most people refer to it. However, it's really important to understand and recognize that it also can happen for seasonal changes in spring and summer. So you might see a spring onset, things are starting to bloom, and it's really hard to see things and people, being cheerful, moving forward, getting outside in the sun, and things are blooming. But yet you still feel very isolated and struggling to have that motivation to get out and do the same things. And so while yes, you do typically see it in the fall and winter, it is still very present also in spring and summer. Um, it may be present if noticeable changes to feelings, thoughts, and behaviors when those correlate with the change in season. Again, whether that is fall into winter or spring into summer. A pattern of increased depressive symptoms is present for at least 2 consecutive years. And that's kind of, for anyone that has a background in mental health or if you're curious, that's kind of that qualifier for a major depressive disorder is, at least 2 consecutive years having these symptoms that are impacting your day-to-day life. And so noticing these changes during the seasonal pieces are what is going to get that qualifier for that diagnosis. Um, and then something that is important to know is women are typically more affected than men. A lot of times we're able to identify this earlier in women, and men sometimes it's a little bit more difficult. So what is the difference in winter blues and seasonal affective disorder, and how are they alike? So you'll notice the similarities between the two. Both have, moods that are affected by seasonal change. You'll experience some of those lower moods, the decreased energy, the lack of motivation, maybe even some disruption to your sleep. But the really big difference is the impact of day-to-days and how extreme those symptoms are. For winter blues, you're not necessarily going to have, it's not necessarily a diagnosable condition. You don't necessarily meet all of those criteria for a major depressive disorder with seasonal patterns, but it is still very impactful and it still can be very difficult for people to get through, but may not meet the criteria for that specific diagnosis. Um, they have, again, the milder symptoms. They're able to function with minimal impacts to daily activities. So you might still be able to get out and do things in life. You might feel exhausted. You might feel maybe sad or even just kind of down and blue. But it does not require an actual treatment for you to continue to meet your expectations for your day-to-day life. Uh, with seasonal affective disorder, it does have to be diagnosed by a mental health professional. Um, there's some very noticeable changes. Either you notice yourself or maybe the people around you make comments because they've noticed the changes to, some of your thoughts, some of your feelings, or your behaviors. Maybe you're showing up late to work or you're sleeping longer than you normally would. Maybe you're having an increase in suicidal thoughts or ideation. You're missing work, can't get out of bed, you may require treatment interventions. You might find that this is something that you need a little bit of help with to get through and finding some new coping skills to be able to get back to those things that you once were able to do. So what causes seasonal affective disorder? while there's different kind of theories out there and lots of research kind of around different things, you'll notice that most of them include that change in serotonin, that chemical in your body that keeps you going forward. Studies have shown that people with SAD, they experience a reduction in that mood regulation chemical, the serotonin. Maybe it's a vitamin D deficiency up here in Alaska, or maybe some of those other states where you get a lot of darkness, you don't get a lot of vitamin D from the sun. There is often a deficiency, which makes it really difficult to function and get out of bed and feel some of those more joyful feelings. Researchers have also learned that shorter daylight hours impact the molecules that regulate serotonin. So also kind of some overlap with that vitamin D deficiency. You're not outside, you're not in the sun, you're not doing as many things to, continue creating and regulating that serotonin. Uh, Darkness may increase levels of melatonin, increasing sleepiness. So your mind or your brain is just kind of confused, right? It's so dark all the time, around the clock, that your brain is like, I don't know when it's night anymore. I'm really confused night and day. I don't know when to be awake, when to sleep. And so your body then in turn creates an excess or an additional amount of melatonin. Some common symptoms that go with seasonal affective disorder. There's a lot of, again, overlap with major depressive disorder if you look into our kind of diagnosis manual. Emotional symptoms, you'll have persistent feelings of sadness or hopelessness, irritability or anxiety, loss of interest in activities once enjoyed. And so while you'll notice that these are a lot more extreme than feeling sad or blue or just, not wanting to do something today because you just want to get a little extra sleep. You're just not feeling it today. These are consistently absolutely losing interest, not wanting to do it anymore at all. Everything's pushed to the side. Uh, Physical symptoms, you might feel fatigue or low energy more than normal. Changes in appetite, sometimes you're craving those carbs. Sleep disturbances, you might be sleeping too much, you might be sleeping too little, you might be having more trouble falling asleep or more trouble staying asleep. You might notice some weight gain or maybe some weight loss. Aches, pains, and headaches that are not explained by a medical issue. You might have some cognitive symptoms where you're having an additional difficulty concentrating or making decisions, committing to something. Social withdrawal, suicidal ideation, maybe some self-harm, things that you kind of is out of your normal baseline feeling. So how do we in the mental health field diagnose that, or who can do that? It can be diagnosed by really any mental health professional. That's a therapist. It can be a clinical social worker, psychologist, psychiatrist, a psychiatric nurse practitioner. There is a wealth of professionals out there that can recognize and assess for things like this. You can even, seek help through your PCN, your general practitioner, your doctor. They can help you get those, physical exams to rule out any medical concerns, lab tests to identify, a vitamin D deficiency. They can help you really kind of navigate that outside of mental health, or in addition to mental health, they can be doing the medical piece as well. Especially, up here in Alaska, you'll notice a lot of the PCMs, they're looking for this kind of stuff, especially this time of year with the change of seasons. They're very well versed in, what this, kind of seasonal pattern change looks like so that they can recommend an appropriate treatment course. You'll notice when you're talking to a therapist or maybe a doctor that when diagnosing seasonal affective disorder, you're going to have very pointed conversations. They're going to be asking you specific questions about symptoms or patterns or changes. How long you've been feeling these kind of symptoms. What does your eating look like? What do your sleep habits look like? How did that change from 3 months ago? They'll be really kind of assessing all of these different things so that they can piece together and make sure that you fit this criteria and it's not better explained by something else. So that way we can form our treatment plans. You might even notice some practitioners use diagnostic tools. You'll see the SPAQ. It's a self-assessment of symptoms for a seasonal pattern change. You might see the Beck Depression Inventory or even the PHQ-9 that are all screening for symptoms of depression. And then, to get a formal diagnosis, your mental health professional will be using that DSM-5, which is just that diagnostic manual for major depressive disorder with seasonal patterns. The prevalence of seasonal affective disorder, how often do we see it? You'll notice that in women are 4 times more likely to be diagnosed with seasonal affective disorder than men. And typically the onset of these symptoms occur between 18 and 30. So if, kind of that criteria of 18 to 30-year-old women especially, that is something to be kind of on the lookout, kind of be watching for, assessing those symptoms. Roughly 5% of people in the United States are diagnosed with seasonal affective disorder. And again, because I'm in Alaska, those statistics of those 5% across the United States, 9% of those live right here in Alaska, making us one of the highest rates of seasonal affective disorder in the US. So who's at risk for seasonal affective disorder? It is not lost for words there, sorry. It is not just factored for young adults, women, people living further from the equator. It can affect anyone, really. It can. It's just more likely that the studies have shown that young women living further from the equator in those places that have more of the darker atmospheres through the year, or has a family history of depression or seasonal affective disorder, or maybe you've been diagnosed previously with depression or bipolar disorders, you might be more at risk for seasonal affective disorder. But again, it could be across anyone, any gender, any age, any location, any family history. It could really affect everybody. Some warning signs, things to look out for when it comes to seasonal affective disorder. You might notice yourself or other people talking about feelings of hopelessness or maybe the desire to hurt themselves. You might notice an increase in alcohol use or drug abuse, withdrawal from activity, isolation. Maybe they're not reaching out to people as much as they used to. They're not engaging, they're not coming out, and you know that that's not normal behavior for them. Extreme mood swings. Sometimes those could be, bad mood swings where they're isolating, they're seemingly depressed, or they're seemingly angry out of nowhere. Or it's even on the good side. Maybe they're overly excited and really, really committed to, going out and having this big party weekend, something that is complete change and a major shift from who they are normally. Impulsive behaviors, depression, constant anxiety, if they're saying goodbye to loved ones, kind of giving some of those key warning signs that something's not right, they're not feeling good. Maybe they're giving away possessions, they're engaging in self-harm or self-injurious behavior, increased use of drugs or alcohol. And then again, just that change to normal behavior, change to appearance. Maybe now they're a coworker, maybe they're showing up and they're a little bit more disheveled than normal. And you know that that's, normally someone that would spend time putting on makeup or brushing their hair or, these daily upkeep things with themselves. And so this is out of the normal. Now it's time to start asking questions. So because the military is our primary demographic, how does seasonal affective disorder typically impact our military? We see a lot of it during deployment cycles. So they might be deployed to very different environments than they're used to. Or maybe they've PCS to to a new place like Alaska. They came from Florida, or they've came from Texas, somewhere where it's bright, shiny, and warm and beautiful. And then they come up here where it's dark and cold. That can be a really, really difficult transition. I know I myself came from El Paso during Christmas time. And so at Christmas, we were wearing shorts in Texas. And then I come up here and it's negative 20 something in Alaska, and all in the same week. So it is a very difficult transition, which increases vulnerability to a seasonal affective disorder. Sometimes even if there's no typical history of depression. And so it might be the onset of some symptoms that over time, over the next 2 years, you could start to notice some change in those seasonal patterns. And that's when that diagnosis would be in effect. Sometimes there's isolation and stress. Military members stationed in those remote areas have some harsher climates, more darkness time, less social interaction, less people around, time differences where it makes it really difficult to reach out to other people in the lower 48. And so you notice they start to isolate, and sometimes by no fault of their own, right? Especially out in some of those more remote areas, they just can't get outside because it's dark and very, very snowy. And so that isolation, whether purposeful or, because they have no other choice, it can impact, a seasonal affective disorder or winter blues even. There's also the mental health stigma in the military, but I think that's really kind of sometimes a lot you'll see across all kinds of backgrounds. Stigma around mental health has always been a thing. Hopefully, we're taking steps to continue to reduce the stigma for everyone to seek mental health care. But we do notice in the military sometimes it's very difficult for people to feel like and comfortable coming to get mental health assistance. Also, the impact on performance. So, untreated seasonal affective disorder, it can impair concentration or energy levels, overall functioning. So sometimes they, aren't contributing to the workplace or the work environment like they should. And sometimes, when you're deployed or in a different area, this could mean very different things, right? This could be very serious situations. Or, even here in Alaska, if they're not a deployment, but they live here, but some of the things that they're working on, if you're not contributing, safety really continues to be a major concern. Or even personal life. Some of that rolls over into stress and anxiety at work because you're not performing the way you should or want to. And then in turn, you're more stressed at home, and maybe you're taking that out on family, and maybe they're having some really difficulty communicating in that piece. So some treatment options. There are multiple different kind of options for treatment for the seasonal affective disorder. Sometimes it takes one and you're good. Sometimes it takes multiple, and they can overlap, and they can assist each other to really kind of make sure that you're getting exactly what you need. One simple kind of treatment option for seasonal pattern change would be light therapy or phototherapy. It involves sitting in front of a light box that mimics natural sunlight for 20 to 30 minutes each morning, kind of reminding our brain like, hey, it's time to wake up. It's not nighttime anymore. Even though it's dark, I'm going to put the sunlight and let those kind of UV rays go in through your eyes so that your brain can understand it's time to create some serotonin, regulate that, and be awake for the day. It also helps regulate the circadian rhythms and increase serotonin levels. And there is a lot of research and a lot of studies that says it is effective for a lot of people. Not everyone, but it does work for most. There's also CBT, which is a really good piece of it that's coupled with the light therapy typically. This just helps you identify and change negative thought patterns that are often associated with depression. It can be very effective in treating seasonal affective disorder, especially when you combine with light therapy. So sometimes it is having conversations and challenging some of those automatic thoughts, some of those negative thoughts of, Winter's never going to end. We see that one a lot when, we get towards breakup season and the snow's starting to melt, but it's still pretty dark and it's still cold and it's just gross outside. And it feels like winter is never going to end. And so sometimes it is very much having to sit down and just process those negative thoughts and try to shift some of those. It can be adapted to group setting, engaging in, cognitive behavioral therapy for seasonal affective disorder. Shameless plug. We do one of those here typically in the winter. So it's really cool, and we learn to use those light therapies, and we really go through that shift in thought process and change. Um, Another really cool component of CBT is behavioral activation, promoting activity during times of feeling down and unmotivated, really pushing ourselves to step out and get into, some of those activities that bring us some more of those positive feelings and joy. Studies report CBT interventions have longer lasting effects than light therapy alone. So sometimes you'll find light therapy works faster, but CBT lasts longer. So when you couple those together, you get that instant kind of mood boost, and then you have that CBT that can help with that prolonged boost. Some people choose to go the medication route. You can take, there may be an option for antidepressants that can be prescribed if the symptoms are moderate or severe or somewhere in between. Those are really kind of impacting your day to day and your ability to function. Medications can also be used in conjunction with light therapy and or psychotherapy. Some additional treatment options. There's the vitamin D supplements. Anyone that lives in a darker climate or an area where it gets dark for longer periods of time, you all know that we have to supplement with vitamin D and sometimes more than the typical regimen. And so during the winter months, you'll often see that contributes to some more depressive symptoms. And the way that you can find that out too is asking for that blood draw after PCM, asking them to do lab work to help you understand what is the correct dosage for you and your body type. Lifestyle adjustments. This is a really big one. Again, talking about that behavioral activation. What can I do for day to day to kind of keep that serotonin boosted, to keep myself going? So regular exercise, healthy diet, establishing a routine that can help you manage those symptoms. Encouraging time outdoors during daylight hours, even if it's cold. Finding the right type of gear, what can keep you warm, what keeps you comfortable, but still getting out, still moving around, getting some of that brisk, fresh air, and taking in all of that little bit of sunlight as much as you can. Setting goals for yourself, they got to be small and realistic, achievable goals for daily activity. Maybe it is, I'm going to get up and I'm going to do a 10-minute home workout every morning. And giving yourself grace, but saying, I'm going to do it at least 5 days a week, right? So setting it small to where you give yourself some leeway. If you can't do it today, okay, if I miss one, I can still reach my goal. Avoiding things like drugs and alcohol, so it can be a depressant. It can make the symptoms worse. Communicate with friends and family to avoid isolating. Maybe it's setting a time on your schedule to know I am going to call my friend back home, even though we're 4-hour time difference. I'm going to call when it is not too late for her, but it's still early for me. Kind of finding that right timing so that you still have some sort of support, and finding something that can match up for both of you. Give yourself grace and space. It can be really difficult, and adjusting to differences or the lights or managing these symptoms can be really, really difficult. So giving yourself some grace and maybe some space to just feel it sometimes. You can't recognize that you might be suffering from this seasonal affective disorder if you don't allow yourself to have space to feel the feels. You can't tell a therapist, you can't ask for help if you don't know what you need help with. So what are some coping strategies for seasonal affective disorder? Just mindfulness and relaxation, right? There are a lot of options underneath that, whether it's meditation, it's yoga, deep breathing exercises, all these different kinds of things that can center yourself and help you kind of relax and de-escalate. Um, you can ask for help. You can reach out to friends, reach out to your PCM, seek behavioral health care, mental health therapy, just reaching out and asking for help. There's even 211. I think most states have 211 or a version of where they can call and ask for resources for who can get help. There's also, 988 if you're in crisis. You're really feeling these kind of intensive symptoms or feeling suicidal. 988 is a really great resource for calling and texting. Self-care. That's huge. Self-care is a really big one that almost everyone often forgets. We're so busy taking care of everyone else, whether you're a parent or you're an employee or you're a boss or whatever it is that your role in life is, you're you often forget to take care of yourself. So making sure that you are conscious and aware of doing something for yourself at least 20 minutes a day, right? And self-care does not have to be this big, extravagant, I'm going to go get myself a massage all the time, or I'm going to go do all of these things. It can be really difficult and that's expensive, right? So self-care could be, for me, example, I get up 20 minutes a day every day before my kids and I just sit and have coffee. Sometimes that's just mindless scrolling on my phone, or maybe I'm just sitting there in the peace and quiet. Maybe I'm watching it snow outside, but I have 20 minutes of quiet with coffee all to myself. That is my self-care. That is the gift I give to myself every day, is to not be needed for 20 minutes. And so that can really kind of make or break your day. Set treatment goals. Whether you're in therapy or you're just kind of trying to figure out how to manage on your own because you're not quite sure just yet, or you haven't reached out for therapy yet, set your own kind of goals, and stick to it. If you tell yourself, I'm going to exercise at least 5 days a week, push yourself to really stick to that as much as you possibly can. If you're doing therapy, show up to your weekly therapy sessions. Do your daily light therapy if that's something that you wanted to try, or if you are prescribed meds, making sure you're taking those every day. Yeah. Learn effective grounding skills. Find new ways to cope with stress and worry, and then practice them, right? Keep trying, keep learning. You don't want to learn a new skill in your time of dire need, right? So if you find a new skill, whether it's, five senses grounding skill, whether it's box breathing or deep belly breathing or progressive muscle relaxation, whatever that is, it seems to resonate with you, learn it, practice it when you don't need it. Because then in those times where you're really feeling down or you're really activated and you're feeling very stressed, you can pull that out and you know how to do it without having to try to activate all these other parts of your brain to try to remember how to do it, or where can I find directions on how to do it. It just becomes second nature to you because now you've practiced it and now it's a skill that's actually there available for you to use. Taking a trip. This kind of is hit or miss, right? If it's possible to take a winter vacation, all power to you. Do it. Go somewhere where you want to go, where it brings you joy, or you can start planning a dream trip, right? And have kind of like your dream journal. Um, it's not always kind of recommended if you have seasonal affective disorder, just because, when you're in it and then you go out and you maybe go to the beach for a couple weeks and then you come back to your environment, sometimes those symptoms can feel a little more intense because you've been free of those symptoms and you know what it feels like being in that other kind of area to where the symptoms aren't as present, and now you come back and you have to feel them all over again. It can make the intensity feel a little bit heavier. And so how do we prevent seasonal affective disorder? You can plan ahead. If you've struggled with SAD before, plan ahead, be proactive for treatments to reduce the effects. Maybe you know that you are someone that struggles with that seasonal change during the fall, at the onset, and into the winter. So maybe right at the beginning of fall or just before you get back into therapy and you start reminding yourself some of these coping strategies, so that you can get ahead of those things and start reducing some of those symptoms before they catch up to you all at once. Um, Relaxation, find ways to make work and your home environment comfortable and relaxing. Having maybe setting up those lights in a certain room so that maybe you feel like you're getting some sunshine, or have some relaxing aromas, some diffusers, something that brings you relaxation and comfort in those places where you spend most of your day. Self-care, as we talked about, is one of the most important things. Incorporating exercise as a daily task, something that takes care of yourself. Maybe you're meal prepping so that you know that you're eating right. Organizing your priorities and your workspaces to reduce feelings of overwhelm. If you're one of those people that the walls kind of start to close in on you as the more clutter comes in, make sure you're setting yourself up for each day. And maybe before you leave the office, you clean off your desk. So that way, the next morning when you come in, you have it organized and you're able to think clearly and get started for your day. Continue planning. So plan reoccurring events, outings with friends and family. Having those calendar invites or those things set on your calendar sometimes makes us, push and gives us that little extra drive and motivation, because you already committed to this obligation, and so you're going to stick to it. Check in with others, ask how they're doing, how they're coping. Maybe some people have some experience that they're willing to share, something that helped them, or maybe something they recognized within themselves of when they were struggling, or some triggering, events, or some symptoms that, were really hard to notice. But once it came to light, they were like, oh yeah, I noticed that a long time ago. I just never thought anything of it. So leaning in and asking questions what other people are doing can be really helpful. Support. Be a support person for someone else that may be struggling. If you are that person that recognized some of these symptoms in yourself, or have done some work for seasonal affective disorder, or depression, or really anything at this point, you don't have to disclose all of that information, but if you have education in the piece, you learned from going through that experience, share what that learned kind of information with someone that might be helpful to them. Awareness, knowing what resources are available to you and to the community as a whole, could be really important, right? Whether it's coming to these lunch and learns over the next 17 weeks to learn about these different topics so that you have a little bit of awareness, or if it's compiling a list of resources, especially, with the government shutdown right now. We know a lot of people are struggling, but something I've also noticed is there's a lot of people that are very knowledgeable in resources, and they're sharing them on social media, or sharing amongst themselves with each other. So it could be the very same thing with these things like depression, sharing the resources and sharing the knowledge, because knowledge is power. So some of the local resources here in Alaska, I compiled together. There can be some likely very similar ones if you're at a different military base. You may have some of the same kind of on-base resources if you are not, but you're out of state as well. Again, I referred earlier to 211 typically is pretty standard across most states. And it's just a big cache of resources and people on the other line that have access to knowing what those resources are. We always have therapy and medication management with our Cohen Clinic at Alaska Behavioral Health. So between our agency and our Alaska Behavioral Health Agency, we can meet needs for a whole lot of people in a whole different facets. But we also have, again, those Cohen clinics across multiple states. If you have any kind of military connection, you can reach out to them and get some of that outpatient therapy as needed. If you're local here, there is, light therapy. A lot of times you can rent Happy Lights from J-Bear, Fort Wainwright, or Eielson. If you need any of these resources, you're welcome to email me. I'm happy to send some of those over to you if that would be helpful. Some other general resources would be the National Suicide Hotline. That's that 988 that I spoke of earlier. You can call, text, and chat. If you are a veteran or a military or military family member, you can do 988 and select one, and that'll take you to military affiliated kind of facet of the resource. We also have Alaska Behavioral Health, which serves our community as a whole with a wide variety of programs out there between partial hospitalizations and ILP and serving kiddos and little kids all the way up to adults, all the way up to, inpatient programs as needed. We also have Vets for Warriors. That's a really cool kind of crisis chat line. Again, you can call, text, chat. If you are on base needing, some assistance with some private care, military chaplains are always available. Military One Source is a really great resource. You can always speak to your PCM at the med group on or off base. We have the Military and Family Life, the MFLAC counselors, or we also have True North here locally. And those are just some references. And so if you ever have any questions, or want to know some of those resources or just wanted to ask a question about anything that we covered today, you are more than welcome to email me. That is my email there. The QR code there is the one with my picture in it. That's just all of my information. If you need to call the clinic, if you need to go hold of me or email me for any reason, that's an option. You'll also notice the QR code up there in the top right. That is just a feedback survey. It's just a couple of questions, takes a minute or two. If you have the moment and you are willing to do that for me to give us some feedback of what you like, what you didn't like, so that way we can adjust these and continue bringing some really good, powerful stuff to the community to be able to share with you. Does anybody have any questions they wanted to drop in the chat? Any comments, concerns? I see we have a couple from Anchorage, someone from Arizona. Any other states that are with us today? If you do not have any questions, that is all I had for you today. I appreciate each of you being here today, and I hope that you continue to join us throughout the next 17 weeks across all these different amazing topics that we have. And so I look forward to seeing everyone. Thank you all. I'll stick around in case anyone has any questions. Thank you all.